Health Canada claims to be committed to transparency, but when pressed about who actually writes and approves key government statements about COVID-19 vaccines, especially guidance for pregnant and breastfeeding women, the agency refuses to say. What's supposed to be a straightforward answer has turned into yet another example of bureaucratic secrecy and government deflection. So let's dig in. This report stems from a recent order paper question tabled in Parliament asking Health Canada and the Public Health Agency of Canada to explain two conflicting statements about COVID-19 vaccination during pregnancy. One statement was found in an earlier government response, and it admits that vaccine product monographs are based only on data submitted by manufacturers, and that the safety and efficacy of these vaccines in pregnant women have not yet been established, with no indication for use in pregnant or lactating women being sought by the vaccine sponsors or authorized by Health Canada, and that Health Canada has not approved any safety claims with regard to pregnant and lactating women. Yet, current guidance on Health Canada's website says that vaccination is an important part of a healthy pregnancy, with health benefits for both the pregnant person and their baby. Several vaccines are routinely recommended during pregnancy, including COVID-19 vaccines. They even go so far as to claim that evidence suggests that COVID-19 vaccination during pregnancy helps to prevent COVID-19 infection and the risk of hospitalization from COVID-19 in infants under 6 months of age. So naturally, Conservative MP Cathay Wagenthal asked, how can both of these statements be true? And the official response from Health Canada and the Public Health Agency of Canada is that there's no conflict between these two statements. I find that pretty hard to believe. Health Canada nonetheless went on to say that while product monographs, those are also called the package inserts, are limited to data submitted by vaccine manufacturers, Health Canada and PHAC conduct their own rigorous scientific reviews, drawing from a broader range of evidence, including published studies and emerging research. They say authorization is only issued when the benefits outweigh the risks. But if you remember, back during the initial authorizations of these shots, and specifically as they were being rushed to market for children, I have direct communication from Health Canada's Biologic and Radiopharmaceutical Drugs Directorate Division that they were basing those decisions on feelings, not facts. Health Canada's review of COVID-19 vaccines and therapeutic products is based on qualitative risk-benefit calculation at the population and public health level. It would not be sufficiently accurate to quantitatively calculate risk based on our limited understanding of the virus and the disease. Quantitative calculations, as you describe, which stems from a media request, are more suitable for well-understood diseases. They wrote that in June of 2021. They also regurgitated Pfizer's marketing mantra that clinical trial evidence showed 100% efficacy in adolescents 12 to 15 years of age against confirmed COVID-19 illness. 100%, that seems pretty foolproof, and sure, that works great in the lab with tampered data, but that claim failed in real-world application. Remember those super rare breakthrough infections that soon became commonplace? I do. The availability of safe and effective vaccines will reduce the spread and severity of COVID-19 disease and reduce its social and economic consequences, they further assert, oblivious to the fact that real-world data would soon show COVID cases surging in the very era following mass vaccination. In fact, infectious disease specialist Dr. Zain Chagla said that the healthcare system was traumatized by what happened in the first 3 months post-COVID shot rollout, January, February, and March of 2021. Listen for yourself.
Many of us were traumatized with what happened in January, February, and March of 2021, where there seemed like there was no escape from this. And so, I think this is where, many things came from, right? We didn't have the time to evaluate these tools in a randomized controlled trial and say that this was going to be an effective tool and this wasn't, because of the fact that if you were wrong, people die.
So back to this parliamentary response, Health Canada references a 2022 National Advisory Committee on Immunization statement that supports COVID-19 vaccination in pregnancy and claims that the data continued to be updated in the Canadian Immunization Guide. And all of that sounds official enough until you ask the next logical question. Who wrote these statements and who approved them. And that is where Health Canada's commitment to openness and transparency just disappears behind a bureaucratic curtain. The agency refused to name a single author, scientist, or official responsible for drafting or approving the government's vaccine statements. Instead, Health Canada deflects. They say that content is prepared by agency staff, including medical and scientific experts, and approved through internal review and governance processes. In other words, there's no names and no accountability. The same vague response was given also by the Public Health Agency of Canada, prepared by scientific and medical subject matter experts and formally approved through departmental and ministerial processes. Again, who exactly? Who's putting their name, their credentials, and their accountability behind these statements? Of course, the government, they won't say. They just want you to trust the science, like Premier Doug Ford did in the early COVID days, who claimed trust the experts, but then refused to name them. And then we found out they were all riddled by conflict of interest and profiteering from the pandemic. Which begs the question, if your science is so robust and your experts are so trustworthy, why hide them? Transparency should be the foundation of public trust, not secrecy. If the evidence is solid and the experts are credible, then their work should stand up to scrutiny. This refusal to name names only fuels skepticism and erodes trust in the very institutions claiming to want to protect public health. If Canadians are expected to trust the science and the experts, especially when it comes to pregnancy, why hide who is writing the guidance? Health Canada hides behind a wall of anonymous bureaucrats, calling it the process. But if no one will own the words shaping national health policy, what kind of transparency is that? Look, it's been known for years that the shots don't live up to their taxpayer-funded marketing claims of 100% effective and safe. Yet when people like National Advisory Committee on Immunization Chair Shelley Deeks helped to secure a $3.5 million vaccine readiness grant months before the emergency authorization that brought these rushed to market product into the arms of millions of Canadians, we have to ask, as Deanna McLeod of Kaleidoscope Strategic did, why were officials being paid to prep for these shots before even knowing if they were safe?
Why is she getting ready for COVID-19 vaccines before we even know that they're safe and effective? Why is anybody considering them?
At the end of the day, pregnancy and reproductive health deserve protection from Big Pharma's influence, not compliance with it. For Rebel News, I'm Tamara Ugolini. If you'd like to see more reports on this topic, you can do so at nomoreshots.ca. You can also sign our petition there and put your name to our email list so that you never miss a report on this topic. That's nomoreshots.ca.